Good afternoon. Welcome, Dr. Jurgen Claassen. It's a pleasure to have you here, and thank you for joining us for an interview for the Dutch Brain Olympiad. You are a geriatrician, so I'm sure this will be a very interesting interview. Could you please introduce yourself shortly and into the field of your expertise?
Yeah, certainly. Thanks for inviting me. So I'm a geriatrician. I work at Radboud University Medical Center since about 2004. I do both patient care, so I'm a medical doctor, and I do research. And both patient care and research are focused on diagnosis and treatment of dementia specifically.
Okay, then we will move on to the first question of the interview. What kind of patients do you see?
Well, as a geriatrician, mostly older patients, but in some cases in our outpatient clinic, the ages do range from the youngest one around 30 and the oldest close to 100 years of age. But the majority is over 70 or even over 75 years of age. And they can come with what we call physical complaints. So problems moving around or chest problems, heart, lung problems, and sometimes problems with their brain function. So it's a wide range of things that they can come with.
Okay, I think a great impression of the majority of the people is that these patients are only mentally affected, but I guess that there are also much other problems, also physically.
Yes, it can be problems walking, it can be heart problems, problems with the blood vessels, weight loss, cancer. It's very wide.
Okay, interesting. So what symptoms do patients with the disease experience?
Most come with, so for my expertise, most come with problems in how their brain functions. Complain that they forget things, but sometimes so they have memory problems, but sometimes it's also something else. So they have problems with speaking or understanding words, or they have problems in solving complex questions, puzzles. They may have problems at work. To do their work properly, or they may have problems in daily household things like cooking or driving the car, for example. So it can be various symptoms, but in most cases they relate it to their brain. Let's put it that way.
Okay, so a lot of impact in daily life.
Yes, absolutely, yeah.
Okay. My third question, what are certain criteria or what measurements do you perform in these patients to get a diagnosis?
And this counts for most things that doctors do. Asking questions is a very big step first for all diseases. So we ask a lot of questions about what really is wrong, what do they mean with their complaint? So getting their complaints as clear as possible. And when it comes to diseases of the brain, so we ask a lot of questions like if they forget things, how does that happen? How do they forget it? Is there any recognition if they're being reminded of what they've forgotten, for example? Or if they have problems cooking, we ask questions whether they're distracted or whether they just forget how to do it. So we ask lots of questions to get the symptoms as clear as possible. And then we can do more objective tests. So like you would do in school when you have to do math tests, for example. We ask questions, we have people draw cubes, for example, or draw a clock and put in the hands at the correct time. We ask them to memorize a list of words, and then they have to repeat it. And those are ways to sort of quantify how their brain works.
Okay. And what are underlying causes or risk factors for developing this disease?
For some diseases, it's Some factors are still unknown, unfortunately, so it's a mystery. There lots of research is needed, but we also know quite a few risk factors, and many of these are related to vascular disease. So it's smoking, drinking too much alcohol, not being physically active, so being physically inactive, being overweight. Interesting thing is that also education appears to be a factor. So high education protects, and poor education is a risk factor. And the interesting thing is that these risk factors also already started at relatively young age. So around 20 years of age. So when you start smoking or not being physically active when you're a student, that's already a risk factor for developing a disease later on.
Okay, so now I hear all these risk factors. I assume that a lot of these factors can be tackled by yourself in an early stage.
Yeah. So getting education is something you can do yourself, and becoming active, not smoking, taking care not to drink too much, are things that you can handle yourself, and reducing the risk to get a disease. And of course, it's an investment, because the disease can start at older age. So when you're 60 and 70. So when you're 20, you may not really care about how you are when you're 70, but exactly. I can assure you that once you get to 60 or 70, you become very worried.
Yeah.
So, yeah.
Okay, and what are the current treatment options for preventing or treating the disease?
The most investigated options are to treat vascular disease, for example, treating high blood pressure, getting people to stop smoking, and to become more physically active are very well proven treatment options. But there are also still many things that we cannot stop. There have been many investigations for example, medication to stop brain diseases, but they still don't work very effectively. So there are still lots of research needed to find new cures, but for these treatment options, we know that it helps to prevent or slow down progression of the disease.
Okay, so still a lot to discover in the future.
Yes. Yes, absolutely.
Okay, and are there any indications that AI, so artificial intelligence, can improve current diagnostic tools?
There are several research programs ongoing. To give a few examples, there is one that is looking at speech analysis, and what they do is record or analyze how you speak, which words you use, your vocabulary. And there are very clear indications that your vocabulary changes early on when you develop a brain disease. So, for example, the speeches of Ronald Reagan, former US president, have been analyzed, and they found that his speech was deteriorating a couple of years before he developed the disease. And the same thing is going on for to analyze how people, for example, type in their smartphones, which functions they use and how well they use them. And that may also be a very early change in symptoms, even earlier than you can detect with doing other tests. And on the other hand, there is some artificial intelligence tools that are being developed that are looking at, for example, brain scans, and to see if they can pick up more changes or can pick up changes earlier than the human eye can, for example. So that the future will tell us if that helps.
Okay, so artificial intelligence is a very promising strategy for the diagnosis and maybe also the treatment in the future for this disease.
Yeah, absolutely. I think it's very promising.
Okay. Well, these were my questions. Thank you very much for your clear answers and explanations.